Rethinking mental health. Why Maori culture must lead the solution. Imagine a world where 80% of Maori forensic patients reoffend within a year of release. Not because they are untreatable, but because their care ignores the wisdom of whakapapa and wairuatanga. Now picture a psychiatric model where kaumātua, elders, co-design diagnosis, where land connects to therapy and where puraku, ancestral stories, replace generic CBT modules. This isn't a utopian fantasy. It's the future of mental health, and the data proves it. The myth of cultural competence. Cultural competence is dead. Co-design is the only path forward. We've been trained to ask about whānau and tikanga in initial assessments, but what if that's just colonial psychiatry in a korowai cloak? A 2024 University of Auckland study exposed a harsh truth. Maori patients labelled treatment-resistant in mainstream services showed 72% adherence rates when care was co-led by tohunga, healers, and psychiatrists. The problem? Western frameworks still treat culture as a variable, not a foundation. Case in point. A Maori youth diagnosed with conduct disorder for setting fires was redefined through purakau about Māori-owned. His actions mirrored Maori's quest to control flame for his people. By blending narrative therapy with land-based rituals, his symptoms vanished. The shift. True partnership means letting kaupapa Maori models like Te Whare Tapawa, the four-sided house, replace DSM-5 criteria for Maori patients. As Dr. Maria Baker's research shows, when whānau ora, family wellness, becomes the primary KPI, outcomes transform. Whakapapa versus DSM-5. Genealogy predicts mental health outcomes better than Western diagnostics. What if I told you whakapapa could reduce recidivism by 40% while the DSM-5 fails Maori entirely? In 2023, Hawke's Bay clinician piloted a whakapapa-driven assessment tool. By mapping patients' ancestral ties, land connections, and intergenerational trauma, they identified triggers mainstream psychiatry missed. Result? A 58% drop in acute admissions for participating iwi. The signs? Maori, life force, disruptions correlate with neurotransmitters imbalances. Wairuatanga, spiritual health, interventions reduce cortisol levels by 34%. The challenge? Western psychiatry pathologizes mate Maori illness, as psychosis, yet when clinicians like Viremo Niania Te Whare Mari reframe delusions as kaitia aki, spiritual guardians, communication, engagement source. The $2.7 million cost of ignoring tikanga. Cultural-led care isn't just ethical, it's economical. Here's the open secret. Every dollar spent on kaupapa Maori services saves $4.30 in policing costs. The New Zealand Corrections Department's 2024 report revealed shocking waste. $1.2 million on anger management courses Maori patients abandoned. $500,000 wasted on misdiagnosed mate Maori cases. Contrast this with Tairavitis Mahi Atua initiative. By training clinicians in puraku-based therapy, they cut readmissions by 62% and saved $2.7 million annually. The formula? White label frameworks. Pre-designed models allow iwi to insert local narratives, e.g. Tainui's Hauraki golf stories. Whānau-led care. Families, not clinicians, set recovery milestones. The spiritual elephant in the room. Wairuatanga is psychiatrists' missing evidence-based tool. We published 100,000 papers on SSRIs and zero on karakia efficacy. That's academic malpractice. A 2025 study in The Lancet Psychiatry finally broke the silence. Patients incorporated in wairuatanga, e.g. dawn karakia connected with ancestral lands, showed 45% faster trauma recovery versus CBT alone, 80% higher treatment satisfaction. The breakthrough? Sydney-based Maori psychiatrist Dr. Diana Kopua probed Mate Maori requires Maori solutions. Her Mahi-atua model, which uses atua, deities, narratives to reframe distress, reduced compulsory treatment orders by 91% in Gisborne. Decolonizing the diagnostic room. The clinic is the new frontline of the Te Tiriti justice. Why are we still forcing Maori to perform wellness in Pākehā terms? Maori psychiatrist Dr. Hinemoa Elder's Ihirangi model demands radical change. Replace patient histories with Pepia tribal affirmations. Redefine compliance as whānau gatanga, relational harmony. The result? A 2024 Waitemata DHB trial saw Maori youth engagement triple when diagnosis included Pepea-based identity mapping. Te Tiriti-centric psychiatry. The data is clear. Maori-led care isn't alternative, it's superior. But here's what no one's saying. We don't need more studies, we need sovereignty. In 2026, Tuha's Te Uru Taumatua clinic will launch Aotearoa first fully kaupapa Maori forensic services. Features include Tohunga psychiatrist teams, equal billing for ancestral and clinical wisdom, whenua-based rehab, healing through land restoration, not locked wards, whakapapa EHRs, digital records tracking Maori states alongside lab results. The call to action: divest from DSM-5, allocate 50% of mental health funding to EB-led diagnostics, train hybrid clinicians, require psychiatrists to learn Te Ao Māori frameworks, abolish risk assessments, replace with the Kaumatua-led